And in this illustration, we have an example of a very old school pharmacy. And there's a lot of things in this illustration that I would like to have personally. These are beautiful bottles and examples of old school pharmacologicals. Now, a pharmacy is also a Greek word, and it means a preparer of drugs. So this is now a site where drugs are received from the drug company. They can be stored as inventory, and then when the consumer is ready to take them, to be distributed to the consumer. Sometimes with a prescription, which is a permission slip, so to speak, an order from a physician or a physician's assistant, and sometimes not. We refer to these as either prescription medications or over-the-counter medications. There's different types of pharmacies. You're probably familiar with the commercial pharmacies. In this illustration, you see an example of a hospital pharmacy, which is also known as an inpatient pharmacy. They can be either centralized, and they can also have, depending on the size of the facility, satellite pharmacies throughout the facilities. Some of the places that I worked had a centralized pharmacy, but I worked in a very high intensity area called a critical care unit, so I could only go a few feet to get my very important medications, and they would have a satellite pharmacy that was dedicated to the critical care units. These pharmacies only dispense medications to the inpatients or the outpatients who are being discharged who are at that facility. In other words, you could not come off the street, go into that pharmacy and purchase something. You would have to belong to that organization, either as a patient or as a provider. These facilities provide all of the medications for all of the patient needs from the time they are admitted to the time they are discharged. A little bit different from that is what's known as an outpatient pharmacy. An outpatient pharmacy is usually within the medical or hospital complex, but is not part of the hospital complex. And it is designed to treat not the people who are inpatients, that is, admitted into the hospital, but to those patients who are doing business around or through the hospital, perhaps at the medical offices, perhaps they are visiting after a recent discharge. Ambulatory clinics or a group of physicians' offices within a hospital complex often have these outpatient pharmacies. And they can also be used for skilled nursing facilities or for long-term care. These are not, again, in-house pharmacies, and the pharmacy supply companies usually delivers these medications, or they're kept at the nurse's station, or they can be kept at the patient's care unit. But again, these are not for the acute care, that is the short-term hospital patients. These are either for the patients who have recently been discharged, who are transitioning, or who are in long-term care, such as in a skilled nursing facility. The community pharmacy is a retail drugstore, and it can also be within a grocery store. I know that the CVS in Apple Valley is in one of the grocery stores. These dispense medications or drugs to persons who have a prescription, and they can also have over-the-counter medications nearby as well. They can sell medical supplies, medical equipment, and even some non-medical items. Some of these community pharmacies will still compound medications. In other words, they'll get medication A, medication B, and essentially squish them together and give that to the patient in various forms. One of the newer concepts is something called an online pharmacy, and it's exactly as you would hear it. This is a pharmacy where you access it through the online modem. This can be on a computer or a smart device like a phone or a tablet. The good part about these online pharmacies is they're extremely convenient, and the medication is shipped to the patient. This is good if the patient has some sort of infirmity that prevents them from getting out and about, or is simply too ill to get out and about. These are accredited pharmacies. They are policed, and the policing agency is known as the National Association of the Boards of Pharmacy, or the NABP. Earlier in the last slide, I mentioned something called compounding. Compounding is when you use things like a mortar and pestle to crush the ingredients. They will then be mixed together, and this forms a new drug. That new drug is now packaged for the patient. Perhaps this needs to be done to flavor a medication. Perhaps we need to give it to a child and it's just impalpable, so we give it a flavor so that the child will be more ready to eat it. Perhaps we're doing this because patients are allergic to the ingredients, such as things like lactose or gluten, and we can change or substitute out those inactive ingredients for ingredients that won't harm the patient. A little bit about technology in the pharmacy. E-prescribing means that these no longer require to have the handwritten prescription, which the joke is nobody can read anyways. In other words, we can use email, faxing, other electronic devices to recreate this prescription and electronically transfer it to the required pharmacy. And this is all around pharmacy informatics. These are computerized database which stores the drug information itself, automates its retrieval, and helps to categorize and organize these medications even for patient consumption. Now, how do we keep organized and how do we prevent problems from happening? Well, in follow-up presentations, one of the things we're going to be talking about are medication errors. Much of the technology is used to prevent giving the wrong medication to the wrong patient at the wrong time, etc. We can use barcode technology to properly identify both the medication and the patient. We can use technology like robots to refill these prescriptions. And the reason is because humans are easily distracted. It is a problem whether you're in a community pharmacy, whether you're in a hospital-based pharmacy, or whether you're the person who's dispensing the medications like a registered nurse. Ongoing problem is distractions in leading to errors or omissions in medication administration. Outpatient pharmacies usually have corporate technology chains, and they all link together, and this allows for faster prescription fills and faster refills and better organizations. However, the caveat of that is privacy, because we are well aware that the larger the computer system, the more likely it is to be breached and compromise patient identification and patient safety. Other things that encompass technology in pharmacy is the availability of drive-up windows. Without technology, the pharmacy technician would never be able to access the patient information or the medication information, and it would be unsafe for a person to simply roll up to a window and be handed a medication. Technology has allowed that to remain safe. And another thing we can do is actually have technological medication dispensers in the patient's home, which will only dispense the medications when they are required or when they are scheduled.